Welcome back to your advanced prescriber course in psychedelic therapies. In this module, I'm going to be talking a little bit about patient counseling for the psychedelic experience. I believe patient counseling is an important aspect of really any type of therapy or treatment, but perhaps it's even more important with psychedelics because of the types of powerful and intense, non ordinary states that they produce. So I personally think that psychedelics might require or will require more education and counseling prior to particularly the first use relative to other types of treatments for the sessions or treatments to go well and for a person to kind of know what they're getting into and they may expect. So I would expect that a portion of these preparation psychotherapy sessions really are dedicated to discussing potential effects of psychedelics as well as how they're going to be administered and the logistics of the day. So there's probably going to be a fairly extensive kind of counseling and preparation psychotherapy, but I think that just about any mental health professional, either now or in the very near future, is going to have to be adequately prepared to give just a shorter version of counseling around psychedelics in a non judgmental kind of way. I think at this point in time, there's still a lot of stigma and misinformation out there about psychedelics. And if a person, patient, client asked you about them, they may not get kind of a best practice kind of answer. So I think some of the biggest questions that persons or patients may have about psychedelics or the psychedelic experience is, what do they do? And psychedelics do a lot of different things depending on the kind of angle that you're taking or looking at. So I think that it's important to kind of emphasize to persons that they do a lot of different things. And there's a lot of different things that are possible. And when you hear people talking about psychedelics and the psychedelic experience, you get so many different stories and angles. And oftentimes the stories or angles really kind of highlight or kind of focus on one area or aspect of what's possible with psychedelics. So let's kind of walk through some of those now on this slide. So first and foremost, they create a non-ordinary state of consciousness. And they have been termed classically things like hallucinogens. Psychedelic, I think, is a little bit better. It's like an umbrella term meaning mind manifesting. But depending on which substance you're using, there may actually even be more specific sorts of terminology that could be used. Things like enactogen or empathogen for MDMA, things like entheogen for psilocybin, or things like a dissociative or dissociative anesthetic if you're talking about ketamine. They induced states that are oftentimes recognized as spiritual. So spirituality is a little bit of a loaded term, and I don't want to say that a different type of substance couldn't have a spiritual quality or a spiritual effect, but it really seems that there's something about the pharmacology and effects of psychedelics that really kind of engender spiritual feelings in a person. They increase emotional vulnerability and suggestibility. So this kind of goes back into really kind of creating a tight container for their use and ingesting it with persons that have their individual's highest interests or kind of best intentions in mind and can be neutral enough that they're not putting inappropriate suggestion and things like that into the therapy sessions. Some persons conceive of psychedelics as non-specific amplifiers of consciousness, so they tend to make external or internal stimuli kind of heightened in some way. Another perhaps way of thinking about this is that maybe our sober, normal, waking consciousness is filtered, or there's these different layers or filter that the brain, mind, or consciousness kinds of has. And psychedelics remove some of these filters to allow more data or more information into a person's field of awareness. They expand awareness and the emotional range. So a lot of times persons are, am I going to have a mystical experience or am I going to have a bad trip? And, I think that an experience that is characterized purely by spiritually ecstatic and positive feelings for the entire duration of the psychedelic is quite rare. I also think that experiences that are just adverse, challenging, dysphoric, terrifying for the entire duration of the psychedelic experience is quite rare. But what is very, very common is a person will kind of traverse a vast emotional kind of territory that includes some kind of spiritual highs or peaks, as well as difficult feelings or emotions. They change the meaning of our perceptions. So there's a lot of discussion in neuroscience about rewiring the brain with psychedelics, or the kind of neuroplastic effects they have, neurogenesis or dendritogenesis. So it could be that psychedelics are inherently about unlearning and relearning, or changing the meaning of our perception overall. They modulate sensory information, so this is almost like a hallucinogenic or illusory type of effect that they have. They can cause kind of a blending of the senses, or a synesthesia. And probably the most common types of changes are visual changes, but other types of changes can occur as well, auditory changes, etc. They generate psychosomatic effects. So psychedelic means mind manifesting, but I really wish that they rename them psychosomatodelics, because it seems like a full body, holistic organism type of experience. If you really observe quite a few psychedelic experiences, person time will oftentimes have moments where it feels that physical catharsis is occurring. Sometimes there's a big grieving kind of sadness and cry, or a gut splitting kind of laughter, or even kind of a hyperreflexic sort of shaking that and occur, or a kind of twitchy sort of nervous system. So don't discount the somatic effects of psychedelics. They provide experiences with high personal meaning and significance. So it's kind of like, how could a psychedelic be helpful for lots of different kinds of mental illnesses? Well, you could definitely kind of do I would say, like a pharmacologic kind of explanation for that. And it's not uncommon in psychiatry that we have one class of drugs that's helpful for several different kinds of illnesses or indications. But I think the other aspect of it is the kind of experiential or subjective experience portion of psychedelics that really is unique compared to other kinds of treatments or psychiatric regimens. And the experience itself is highly personal, meaningful, significant. And there's some data and research that persons will, rank the psilocybin mushroom experience, or the psilocybin experience, as one of the top 5 most meaningful experiences of the person's life. And then I think, lastly, they rapidly and persistently reduce symptoms of psychiatric illness, particularly in the psychedelic-assisted therapy context. And that's where I'm extracting that from clinical trial data looking at psychedelic therapy. Let's talk a little bit about side effects now. And I would say that some of the side effects that you see on this slide are going to be more common with some psychedelics than others. So nausea is a really common one with many different types of psychedelics. Emesis, or actually vomiting, is quite a bit more rare, but there are some, for example, like ayahuasca, where emesis is very common. It's 50% type of event, whereas most psychedelics, nausea pretty common, but actually vomiting would be a little bit more rare. So the things that you kind of see here in the common, like more than 10% left-hand portion of the slide, occur transiently during the experience. So again, these aren't really effects that characterize the entire experience. It's usually experienced for some period of time, perhaps 20, 30 minutes. Sometimes in the come-up phase or towards the peak of the experience are probably the more common points where a person could run into some sort of physical or emotional difficulty. On a more rare basis, you have things like paranoia or suspiciousness. So sometimes, psychedelics are trippy, they trip you out. And sometimes, even with good rapport and trust, a person can get into an experience and an hour or two into it, things kind of flip around and all of a sudden they're very suspicious of the facilitator or provider and thinking they may not have their best intentions or interests at heart and things like that. And I don't know, there are nefarious persons out there using psychedelics where that could be true, but I think for the most part, if you're talking about psychedelic assisted therapy and measuring these things in clinical trials, I would probably kind of chalk it up to that's part of the psychedelic experience on more rare kinds of occasions. I kind of mentioned like the bad trip. Yeah, challenging, difficult emotions, transiently, very, very common. An experience that is just dysphoric and adverse for just about the entire time is a lot more rare. Adverse events like seizures have occurred out there in recreational settings, particularly with substances that might have seizure potential or lower seizure thresholds, things like MDMA, for example. But in clinical trials or in controlled settings where they have a thorough or adequate kind of screening process, they have yet to see a kind of severe adverse event like a seizure occurring. So as far as post-use effects of psychedelics, kind of feeling a bit of a tension headache the next day is pretty common, particularly with psilocybin. Some persons, I would say like more commonly with MDMA, actually, MDMA kind of has, I would say like a post-use low to it or kind of like a refractory period for a period of a few days, maybe up to a week afterwards, where the person really does experience a little bit more anxiety, irritability, maybe difficulty sleeping, or some sort of mood change. But for the kind of symptom benefits that they've seen as far as reductions of PTSD symptoms, these kinds of transient post-use effects seem quite tolerable and mild in comparison. Post-use visual phenomena. So this is, I think, an interesting one in that many persons, actually, even persons that ingested psychedelics in clinical studies, will report some kind of post-use phenomena, maybe a tracer in their visual field in the days afterwards. Most of the time, this occurs once or twice in the short period of time after using a psychedelic, within a few days to maybe a week or two. But for some persons, they have these occurring on a more consistent or a longer term basis. And by and large, it is kind of subtle, mild, not distressing, and doesn't really seem to be associated with pathology. On the kind of flip side, there is HPPD, or hallucinant persisting perceptual disorder, in which the post-use phenomena is quite a bit more intense and the person really does find it distressing, bothersome, or it's so intense that they have difficulty kind of functioning. So post-use visual phenomena, a little something, most likely benign, don't have to be really worried or anxious about that. But on a more rare kind of basis, persons have had things like HPPD. And I'll say that we don't really know exactly what the cause of HPPD is, but it seems to be sort of associated with, I would say, like unsafe settings, higher doses, and an experience with the psychedelic that is inherently scary or kind of traumatizing in some way. If you're really going to go through the HPPD literature, there's been a few nice review articles that have come out in the last couple years that seem to really kind of be highlighting that. Kind of feeling more sensitive. It seems like psychedelic kind of dial up emotional sensitivity. And for some persons that have maybe be feeling kind of like numb or gray or in some kind of rut, this kind of feeling more sensitive can be really nice. For other people, it can kind of manifest more as like reactivity, and it's potentially harder to regulate emotion for some period of time afterwards. And so I think psychedelics, we talk about them as diminishing the default mode network and being a functional reset and things of that nature. And sometimes this kind of resetting mechanism can be fairly extreme. And the person can feel almost like blank slate, tabula rasa, and sort of be questioning like, man, I'm not really sure if I know who I am. And there's something about the psychedelic experience that can sometimes present itself as hyper real or more real than waking reality. And then when the person kind of comes back to waking reality, they're left thinking, what is real? Is this world real or not? So depersonalization and derealization can sometimes come up for persons after psychedelic experiences. Say we had not seen post-use adverse effects like suicidality come up around psychedelics in clinical trials, except for recently. There was a large phase 2b study of psilocybin-assisted therapy for major depression, and it was not, they couldn't run statistics because the numbers were too small. They didn't have the power for it, but there was kind of an alarming rate of post-use suicidality that came up in the kind of higher dose psilocybin groups that they did not see in their very small dose kind of active control group. So I'll say that that's kind of like one to watch. It's kind of almost an anomaly in this trial. So perhaps it has something to do with the way the psychedelic assisted therapy was conducted or the preparation procedures. But I would say that that's kind of an area that needs to be watched closely moving forward. So to summarize and conclude, psychedelics can produce really sort of diverse experiences amongst different people. They kind of commonly have this intense, non-ordinary state of consciousness where persons experience a range of both pleasant and unpleasant types of feelings or effects. And some of these side effects or things that we adjudicate side effects in clinical trials could just be physical. Okay, serotonergic psychedelics could just physically produce nausea. But at other times, maybe I have generalized anxiety and I wake up with this kind of anxious, nauseous pit in my stomach, and then I use psychedelics and I feel this anxious, nauseous pit in a more intense way. That actually might not be a side effect as much as a potential kind of therapeutic opportunity or way of relating to the difficult emotions that you encounter normally in your life in a more healthy kind of manner. Appropriate counseling, realistic expectations, these are two things that can really improve the safety and benefits of psychedelic use. Thanks so much for your attention in this module, and I'll catch you in the next one.